This presentation discusses complex issues. The opinions expressed by each speaker represent only the individual speaker's opinion and does not necessarily represent the viewpoint of the conference organizers. Please note that with any individual patient, due to details specific to the case, the Jewish legal decision may be different than the general guidelines expressed here. For the Jewish opinion in individual cases, please consult with a competent rabbi well-versed in Jewish medical case law.
Ladies and gentlemen, welcome to the session on Judaica and ethical issues in organ transplantation. The time allocation has been truncated, so each speaker will try to restrict the comments to 15 to 20 minutes. We may have a few minutes at the end for questions. We'll start with a transplant surgeon, Dr. Amy L. Magura-Friedman, who's co-director of the Kidney Transplant Service at Yale College of Medicine, and she will consider the difficult question, can you be too old to get an organ transplant? Dr. Amy Friedman.
Thank you. Let's see. Okay, so in fact, I'm going to very briefly touch on a couple of topics, not only the issue of age in transplantation, but a couple of topics that touch on the whole issue of the shortage of organs for transplantation. And really, as you can see, kind of in a comical touch, the question is to P or not to P. Who can we help with organ transplantation and replace the missing bodily functions for those who need them? And since this is an ethical topic, I will do a very brief case presentation and note on the top that this is a HIPAA-compliant case presentation. So within the past 2 weeks at our facility at Yale in New Haven, I've taken care of a patient. This is a real patient, a 76-year-old man who was admitted to the hospital with new onset of a second stroke. With this stroke, he newly became unable to stand without assistance. He had 9 years earlier had undergone a deceased donor kidney transplant. His end-stage renal disease was from type 2 diabetes and hypertension. He also had gout. Between his first and second stroke, he continued to live at home with a supportive family who administered his large number of medications and transported him to medical appointments, taking exquisitely excellent care of him. He had stable kidney function when he was admitted to the hospital, and throughout his 10-day stay continued to have excellent stable kidney function. And unfortunately, as a result of his stroke, would require placement in a nursing home because his level of care now would surpass what his family was capable of administering to him, and they did not have the financial resources to be able to care for him round the clock with full nursing care at home. They could not afford it. So the question I'm going to consider here is, was it right to use a kidney for this patient 9 years ago? At the age of 67, was it right to use a deceased donor kidney for a man, a diabetic patient who had a limited life expectancy 9 years earlier with end-stage renal disease? If we think about it now, fast-forwarding 9 years later, had we not done the kidney transplant, would he have lived 9 years? Statistically, there is no question that the answer is no. 9 years later, he would have had a virtually 0% chance of living. His quality of life 9 years later, if you asked him, and I did ask this, and we did ask his family, unquestionably in their minds was still good enough, and I can tell you, I know this family quite well, they still, even at this point when he's become substantially debilitated, and I will say that even with the second stroke, there is a good amount of expectation that ultimately he will come out of the nursing home and be able to go home to his family again. They still think that his quality of life is good enough that he wants to continue living, and he will live with this kidney transplant. But using a kidney for this individual is not what we would have expected would be the commonplace occurrence in the early days of kidney transplantation. This is not what we thought transplantation would be all about. However, it is what is commonly happening in transplantation today. Patients using handfuls of medications, which is a very demanding thing for the patients who need to take who are having transplants. But this is what is happening with transplant patients. These are a series of geriatric, famous celebrities who have all had kidney transplants. Yuri Andropov, Ferdinand Marcos, Neil Simon most recently, Irma Bombeck, Bernard, all over the age of 65 years old, all who have, and this is all from publicly available information, had kidney transplants over the age of 65. So that this is a very commonplace occurrence today. Of these 5 individuals, to my knowledge, again, from publicly available information, only one of them is still available. And so the ethical question I'll put to you is whether or not what we are doing across the world today in using organs for these aged individuals is a reasonable undertaking. Again, of these 5, only one is still alive. And the question is whether this very scarce set of resources ought to be used for these people who have limited life expectancy. At our center in Yale, New Haven, I can tell you that now, of the new candidates that we are seeing, it's now gone to over 20% of the patients we are seeing are over the age of 65 years old. And so it's a very commonplace thing for us to see. I can tell you that we've looked at a series of 434 consecutive transplant recipients now. 10% of them, or 43%, were over the age of 65 at the time that they had transplantation. Now, we routinely, and I would like to share a little of the results of what the outcomes were for these people over age 65. What actually happens when we do the transplants? And the patient who I first introduced to you, the 67-year-old, who's now 9 years out, is one of those patients. We carefully assess the cardiac status of all of these patients before we will do a transplant for them, and we will even go to the point of catheterizing them to know whether their coronary arteries are okay. And we found, in fact, of these 43 patients, 21% had pretty serious rhythm disturbances. 1 had had a cardiac arrest in the past. 10% had had a myocardial infarction or a heart attack, for those who aren't medically, don't understand what that means. 1 of the patients even had an implanted defibrillator. These are pretty sick patients all in all. In other words, these are not young patients. They're typically older patients with typically older patient diseases. These are pacemaker spikes on a preoperative EKG of one of these patients. But this is what happens, even taking these older patients with older patient diseases, if you carefully screen them and take meticulous care of them,